I guess living within my means.
Right.
It's just that my funds don't match up to where I want to be. But honestly, I've within learning and listening to different podcasts and just kind of constantly educating myself, I find that like it is a matter of living within your means.
Sure.
And so when I can do it, I will do it.
You will do it.
But when I can't, I learn to take a step back and do just what I need to do for myself.
Right.
Yeah.
Good. And now, currently, do you find that within all of your expenses, is healthcare insurance part of that expense?
So, we are entering February, or actually, we're already in February, and I just had to renew my healthcare.
Okay.
And I was getting phone calls here and there about renewing my healthcare and all sorts of different things and getting different options. And I had healthcare, and I don't know if I should be saying it out loud what I had.
I don't think it matters. But
okay, but
I think it's fine.
Okay, so I'm gonna say I had Oscar Insurance, and I had a pretty good plan with them.
Right.
And I want to say that I was pretty consistent with the payments and how it worked within my favor.
Right.
However, they didn't offer me everything that I wanted.
Okay.
So, for example, I had a full-time job.
Right.
And I was making full-time hours, and I was getting, full-time care.
Now, wait, so you were getting health care insurance?
I was getting health care insurance with my full-time job.
Okay, got it.
And, I mean, it was great.
Did you have to pay for it at all?
I didn't have... Well, I wasn't aware how much I had to pay for. Maybe it came out of my bill, but it wasn't like anything that I was aware of.
It probably came out of your paycheck and you probably didn't realize. Like a small amount.
Yes, okay. So a small amount came out. But when it came to, my dental, my medical, every time I went for a visit, if I was sick, if it was an emergency, whatever the case was, I feel like I never had to worry about that.
Right.
And if something came in the mail, I would just check it and I would take care of it, whatever the case is.
Okay.
But it was pretty much taken care of.
Right.
I felt so confident that my healthcare was taken care of.
Right. Exactly.
And it isn't until that I transitioned out of my full-time position that I went into, getting my bachelor's degree, which I can say that I've achieved, and now I'm, going for my master's degree and doing an internship. So I had to pull back from my full-time hours.
Right.
Which led me to not getting full-time healthcare. Or not getting healthcare at all, actually.
Right.
And so I had to get my own healthcare.
Right.
And which was definitely something that I was not expecting or...
You weren't prepared for.
I wasn't prepared for, exactly. And it led me to having to take on a bill that I had to take care of every month.
Yeah.
And even with the total amount, I can actually honestly say I think it's about $200 a month that I had to take care of, which is pretty high. But it didn't cover everything. I mean, with my full-time, I had physical therapy as a dancer, as a gymnastic instructor.
That kind of stuff is important.
It's important.
Sure.
And so I didn't have everything that I wanted to within my healthcare coverage. And so dental was covered, physical therapy was covered. Now within this current insurance, I literally have the basic bare none of just like going, paying my little copay, and that's it. If there's an emergency, I'm not covered. If there is, I don't have dental.
It's crazy.
And so it's kind of disheartening a little bit.
It's
like,
very disheartening.
Where I work as many hours as I do and I contribute to society as much as I do, but I'm not allowed to get as much coverage as I can possibly get because of this. Which is kind of, it's a little... I'm going to take a sip to that.
Yes. Aww. It's disheartening, actually.
It is. It truly is. It's disheartening. So, I feel like, within where I want to be as a creative, I wish and I would love that my government really would provide more for us, compared to, having to provide all these hours and time within a system that, can only give me so much.
Absolutely. Well, I had, interestingly enough that you bring that up, I had a client of mine, she works in theater. New York City. She was hiking one day. Just fell and broke her whatever, her leg or something. It was such a bad break.
Yeah.
And